everyone, my name is Isaias Davila and today I am going to be presenting COVID vaccinations for children. What are COVID vaccinations and what is COVID-19? I'm sure everybody knows what COVID-19 is, but for those who don't know, COVID-19 is started since 2020 and it's been affecting all over the world. Has caused a lot of deaths. But there is a way to prevent that, which is the COVID vaccinations. Although there's not for children, and that's why we should get for children so they could wipe it completely, like the flu, so it won't spread as easily. What could happen if your child gets COVID-19? All youngsters are able to get COVID-19, but it won't be as bad as it affects the adults. Nonetheless, a few kids become seriously sick with COVID-19. They may be hospitalized, treated in the emergency unit, set on a ventilator to assist them with breathing. According to the American Academy of Pediatrics and the Children's Hospital Association, and the U.S. children represent about 15% of all COVID-19 cases. COVID-19 in children has been on the rise in the U.S. with a recent 10% increase in the total number of reported child cases. The reason why children with COVID-19 has been increasing is because children are naive and clueless to what is happening around them. They also tend to be extremely delicate. Now that the country has allowed students to go to elementary schools, this puts them more at risk because some children don't know how to cover their mouth when they sneeze, or they do not know how to wash their hands when they're done using the restroom. Also, they don't know how to keep the rule of the 6 feet apart rule. They tend to be they tend to touch each other a lot. Can babies get COVID? Yes, they could. Infants under the age of 1 may be at greater danger of extreme sickness with COVID-19. This is logical because their framework is very weak. How they could get COVID-19 is if you don't take care of yourself. So when you have your child, make sure you have a mask, make sure you don't have any symptoms, check yourself. If you do that could cause why babies get COVID-19. There are not any vaccinations for infants, but if there were, getting early vaccinations for children has many significant advantages. It assists with shielding them from diseases, for example, all the other diseases such as pneumonia, pertussis, that can be lethal when they're safe for Americans defenseless. Since specialist workplace and facilities have gone to explicit lengths to forestall the co-exact spread, youngsters' vaccination shouldn't be deferred. This is particularly valid for youngsters with exceptional conditions, such as those with chronic diseases. Talking about chronic diseases, kids with hidden conditions like adiposity, diabetes, and asthma may be more in danger with sickness of COVID-19. Kids who have inborn coronary illness, hereditary diseases, or condition influence the sensory system or digestion likewise may be at a greater danger of COVID-19. Also, children can bring more variants that can develop more other viruses, another strand of COVID-19. It is said by Catherine Bennett, data show that children and particularly adolescents can play a significant part in coronavirus transmission, says Catherine Bennett. So she is basically saying that children and older people can cause another strand and can spread the virus more. COVID vaccinations. There are currently vaccinations for 12 years and older. The Pfizer BioNTech is giving them. For those younger children, it has been said that they are currently working on those vaccinations. Estimate time that that they will be finished will be around the end of December 2021.